Hello, everyone. Let's just give it a minute or two to let a few other people join. But welcome to this webinar. Excited to have you with us today. Great. Thank you, Jack, for sharing that booklet with all the biographies. Really appreciate that. And for those that just joined, welcome. We are just letting a few people in and getting started in a moment. Okay, let's just give it another 30 seconds or so and then we'll kick off. Okay, I think we can get started. So, good morning, good afternoon, good evening, everyone, and thank you for joining this today. I'm Tabitha Ha. I'm the Co-Advocacy Director at Stop AIDS, which is a UK-based HIV and health rights network. And we're a co-founding member of the Digital Health and Rights Project, which we're going to hear much more about today and who are hosting this webinar. So, yeah, as kind of Jack mentioned in the chat, please do introduce yourselves. It'd be great to know who we have in the room, where you're joining this call from. So this webinar is called Towards People-Centered Digital Health Strategies, Gender, Equity, Rights and Inclusion. It's very important that our sector explores this topic more deeply, as every day our access to health information, to healthcare and services, and even decision-making is increasingly reliant on online access and digital means. So we are even seeing the take-up of AI technologies in global health. So, and as an advocate who has been fighting for many years on the HIV response and for the end of AIDS, there is so much that innovative new technologies can offer in terms of scaling up the response and reaching the most marginalized. However, there are risks and there are challenges, including huge risks that digital technologies and AI may amplify the already existing inequities that we face in our local communities and at the global level. So it's great that we're going to hear today from this excellent set of panelists. If we can just put the slide up with all of our excellent speakers, please. Yeah, so today you'll be hearing from the set of speakers. Firstly, we'll be hearing from Professor Meg Davis, Principal Investigator of the Digital Health and Rights Project, based at the University of Warwick. Then we'll also hear from Quang Le Tu as part of that, a researcher at the Vietnam Network of People Living with HIV. And then we'll have a very short time for Q&A and then hear from our second panel, which will include Franco Serra from the University of Oxford, and then responses from James Kalu, a member of the Kenya Community Advisory Team for the DHRP project, and Tahani Alabda, Technical Officer at the World Health Organization. So, and then there will be time for a Q&A following the second presentation as well. So Our session today is to have an introduction to Digital Health Rights Project first, and the participatory action research that is taking place in 4 countries that is leading to a much deeper understanding of young people's experience with digital health and its interplay with human rights, and also to share the findings from a new Digital and Health Rights Project report, which examines gender equality and human rights in 20 national digital health strategies. So we can kick off, but just first, just to note, thank you to Jack, who is moderating the chat. And yes, please do use the Q&A and the chat to raise questions. Yeah, you can start preparing your questions as the speakers go ahead. So first, our speaker will be Meg Davies. So I'll hand over to you.
Great. Thank you so much, Tabby, and so lovely to see so many friends and colleagues from all over the world joining us today. So I'm Meg Davis. I'm the principal investigator of the Digital Health and Rights Project, a big, wonderful, diverse consortium of activists and researchers, youth leaders, and civil society, human rights experts from diverse countries. So I'm going to quickly walk you through some slides showing you how we're using a transnational participatory action research approach to studying human rights in the digital transformation. And this is really, I think, one of the first projects to study the digital age using transnational participatory action research, in which the people who are being studied actually participate in designing and implementing the study, reflecting on the findings and using them for action. So I'm going to share a little bit about why we're taking this approach, how we're doing it, and then hope that you'll come back and join us again next year when we'll share the findings from the study that's currently underway. So on the next slide, as you'll see, we are in this context in which the digital transformation of many aspects of our lives is underway, including this call as one example of that. And leaders from UN agencies, and here we have Volker Turk, who is the High Commissioner for Human Rights, Amandeep Gill, who's the UN Tech Envoy, and Dr. Tlaloing Mofokeng, who is the UN Special Rapporteur on the Right to Health. And they and others have really called for human rights to be at the center of the governance of digital technologies. But what does that mean in practice? And what does that mean in particularly for young adults and civil society groups in low and middle income countries who are very much not part of governing digital health and digital technologies right now? So on the next slide, as you can see, we've launched this consortium originally in 2019 with a small group of about 8 committed activists and researchers. And now, as you can see, this is us gathered in Nairobi last year. There are now about 50 of us internationally who are full or part-time staff working for the global network of people living with HIV and their member networks in Ghana and Vietnam, KALIN, which is a human rights NGO in Kenya, Privacy International, a digital rights group here in the UK, Restless Development, which is a global network and NGO working on youth leadership, Stop AIDS, which Tabby represents, a longtime AIDS advocacy group, Universidad de los Andes, leading university in Colombia, and we here at University of Warwick are the host and secretariat for the project, supporting this large, diverse consortium with wonderful support from our funder, Fondation Botnar, which is a Swiss private foundation. And we started in 2019. On the next slide, as you can see, we started with smaller studies, also using transnational participatory action research in 5 countries, Bangladesh, Colombia, Ghana, Kenya, and Vietnam, and really came together to try to understand, with all of the excitement about digital health, what are some of the realities experienced by young adults in their diversity in low and middle income countries? Do they see this as a positive trend? Do they see it as one that exposes them to new risks? Or in many cases, is it a little bit of both? And so what we did is we worked through national NGOs and universities, collaborating together in a big research team that meets once a week. And we developed shared tools, protocols, we got ethical approval, and then we launched focus group discussions with young adults ages 18 to 30 in these 5 countries, as well as interviews with experts from UN agencies, from government, private sector, and civil society, as well as academia, to understand what they saw as the risks and benefits of the digital transformation of health. And we took all of this data back to the communities who were part of the study to ask them if we had gotten it right, and then to develop together, with a lot of support from StopAIDS and others in the consortium, a shared advocacy plan in which we took the findings and shared them with different UN partners and civil society groups. So this was our first kind of pilot of this participatory approach in which communities were part of the study, part of developing the study. But it was a very small project. Even though we had 250 participants, we had very few people who were paid to actually work on this project. And so it was really just kind of a first stab. And so what we have then done as we continue on to the next slide is begun to use these findings to develop our new research project. So from these first studies, what we understood is that what we think of as digital health at UN agencies and academia is not necessarily what young people think of as digital health in the countries that we're looking at. For many of them, digital health is Google, where they go to check their symptoms, or it's social media, where they go to ask for advice, or it's a WhatsApp group, or in Vietnam, a Zalo group, where they post questions to peers. And so that is much more the first port of call for many of the young adults that we spoke to. And that has real implications in terms of the kind of sexual and reproductive health information they get, the kinds of HIV information they get, and the exposure to harms, including misinformation, censorship, stigma, verbal abuse, and violence in life, in real life, not only violence online. A lot of the young adults we spoke to had real concerns about the risk of surveillance, but not much information about what the realities of surveillance are. So a feeling of being watched without really knowing who is watching. A lot of sense of inequalities linked to who has access to these platforms and when, and that these inequalities are shaped by class, education, gender, language, disability, and location. So the access you might have in a farm in outside of Bogota could be very different from the kind of access you experience in the center of Bogota, for example. We also found, though, that young adults expressed a lot of trust and faith in their peer networks to help them navigate these challenges, and that many of them were turning not to, as we might hope, WHO or the public health system, but actually were turning to social media influencers for health information and advice. And so with this in mind, what we found is that a lot of young adults were calling on their governments to do more to develop digital health, but also to partner with these social media influencers. And I see a few of them on this call right now, which is wonderful. So we're looking for more openness to collaboration outside of the usual kind of social media channels, but to think about how to partner with some of the people who are really effective at reaching young adults with the information that they need and want. We also found that young adults were really interested in learning more about digital health and about their rights and about where they could go to if they experienced harms. So on the next slides, we talk about what we're doing now. So we're now, with support from Fundación Botnar, I have a much larger project underway in which we're going back to some of the same countries, Colombia, Ghana, Kenya, Vietnam, but to go deeper, to understand how digital divides are shaped by different intersecting inequalities, to understand how criminalization affects young adults who are living in countries where their status as people living with HIV, or as members of key populations, or as young women who might be seeking an abortion, how that might expose them to risks, including stigma, discrimination, and even in some cases, risks of arrest. We're trying to understand better the kinds of digital literacy young adults in our study populations want, and what young adults can draw on from the HIV movement in terms of their ability to mobilize and advocate collectively. So how can we build platforms that enable them to engage as voices and as leaders, shaping their own digital rights in the future? And we will have new findings coming next year. I just wanted to share as one last comment on this next slide, how crucial it has been to have the role of the community advisory teams. So in each of the countries, we have a team of a dozen young adults and civil society leaders, some of them working in health advocacy, some on human rights and digital rights advocacy, some on development and other issues. And they are playing a crucial role as really the engine driving this project, including advising on research, engaging in leadership training, as members and representatives on our global governance board, our steering committee, They're going to be validating the findings, which we will be bringing to them in the next month. And then they will be leading national advocacy plans based on the research findings and using them for action to address some of the issues that we're uncovering in this next deeper phase of the research. So it's really a bit of an experiment. There is really nothing quite like this project, and we're excited about the potential. We're aware that there are pitfalls. There are many inequalities across our consortium. We are united, but we also sometimes are divided by race and class and gender and education and opportunity. And so we are really trying to find ways to have open discussions in which we challenge each other, hold each other accountable, and also learn as a community about new forms of research and governance for the digital age. So we really welcome you to join us on this journey, to travel with us over the coming months. You can follow us here. We'll have a QR code later on where you can scan if you want to join our mailing list. And we're excited today to share some of our early findings from a study that we did that we'll talk about in a moment. We're going to move next to my colleague Hoang, who's been a core and a wonderful member of our research team from the Vietnam Network of People Living with HIV. And Hoang can share a bit about his experience as a researcher leading the study in Vietnam. So over to you, Hoang.
But I think it's on mute.
I think you're on mute, Hoang.
Oh, yeah,
There you
sorry.
go.
Yeah,
Great.
so hi everyone. Good morning, good afternoon, good night from everyone from all over the world. So my name is Hoang Lê. Now I'm a researcher from VNP Plus. So today I will share with you some of my work in DHRP project as well as what is VNP Plus. So at first, what is VNP Plus? Now VNP Plus, the place that I working for, this is the Vietnam network of people living with HIV and AIDS. This organization represents the people living with HIV individual group and provincial network in Vietnam. So we work to advocate for the right of positive people, including access to treatment, care, and support to fight stigma and discrimination, and are involved in prevention interventions. So VNP Plus was officially established in 2008, and our operation principles are voluntary, democracy, equality, development, sustainability, unity, creativity, and transparency. So this is some very main point of the VNP Plus. So working with our VNP Plus, we also have a team called Community Advisory. We call VCAT. So working with us in this project, we have VCAT member which play an important role in this project. So what are the role of these team? So the VCAT member, they will provide the national lead organization and the international research team with guidance on their research focus, reviewing protocol and instrument to make these appropriate for the local context. They also mobilize study participants which will help us to do all the focus group discussion as well as the key informant interview. The VCAT also have VNP Plus to they participate in analysis of the data and validation of the study finding. We will have a meeting next week to validate our initial result from the DHRP. The VCAT also advise on evidence-informed policy recommendation that promote human rights for all, especially women and marginalized communities. The VCAT member, they also participate in digital literacy and empowerment training and youth leadership training. They develop and deliver advocacy plans that draw on the research, and finally, they also play an important role in share updates on research and advocacy with the other member of the CAT and the project in overall. So this is some very main point of the role of the VCAT member. So the DHRP in Vietnam, with lead by VNP Plus under the support of the VCAT member. So at this time, we are still working with the initial result, but at this time we found some very early insight from the ongoing research. The first one that we found that from the DHRP project, stigma is a barrier to access to healthcare services online. So we see that from our FGD and the KII result. Many individuals are reluctant to disclose their health issue, particularly though related to mental health or sexual health, due to the fear of being stigmatized. This fear can prevent them from accessing vital resources and support system. We also see that the problem from the misinformation. So the stigmatized group, they often face misinformation about their health condition, therefore leading to further isolation and a lack of trust in healthcare provider. We see that this misinformation can make some harmful thing and discourage individual from seeking help, especially on the cyberspace. The second problem that we see from our initial result that there are some technology facilitate abuse. So we we call them cyber stalking. Some abuser may use social media platform and messaging app, for example, Zalo app in Vietnam, to monitor their victim activity continuously. So the technology facilitate abuse often involve controlling behaviors such as checking a partner location through GPS or hack into personal devices or demanding access to personal account. Such action create an harmful environment and therefore make the study participant fear and making them dependency. We also have a typical case. We call them the Samsung case. You can see the detail from our result from the HRP result. So in this case, the VCAT community play an important role in leading and giving the advocacy and they lead the victim how to respond to false information. So that is some very early insight from ongoing research. So uh, over to you, Meg.
Great. Thank you, Huang. Thank you, Meg. For the summary. It's been a privilege to see this project grow, and it was quite a feat to distill that into a few minutes. So, thank you for sharing. And we were, treated to some of the early findings the other day, and it was a real reminder, when hearing about some of the issues that Huang mentioned around, the role of stigma in affecting people's access to health services online, and this Samsung case, a real reminder about why it's important to explore these issues further and find ways that we can together improve this situation. So we have a few minutes for a brief Q&A with Meg and Huang before we hear from our next set of speakers who will present a different report. So do any of you have questions? Please put them into the Q&A or the chat if you do. Great. So I can see one question so far, and happy to take another. Okay, we'll go for the first question first, and then we can come, and then we have a second one too. Okay, the first question, it's not directed at either, so either feel free to jump in here. But for the first barrier for people to access digital health is stigma. Do you conduct any analysis to compare with the in-person setting? Really interesting question, especially myself coming from a HIV response. So I'll hand over to either of you. And then I see another question in the chat. So the second one is, do you find that certain issues are more prevalent in certain countries? And then give an example of noticing cyber stalking is utilised more in certain places due to culture and laws. So I think both quite general. I think it'd be both good to hear from both of you on those. So who would like to go first?
Huang, do you want to take either of those questions? If not, I'm happy to give it a try.
Yes, I think you can answer first, and I will give additional information.
Great, thank you, Huang. And let me just say also what a great pleasure it has been to work with VNP Plus on this project. They have a lot of experience doing research from their work on the PLHIV Stigma Index, which is another great example of community-engaged research and community-led research that I encourage everyone to check out if you're not familiar with it. So on the first question about stigma, it's a really interesting question because stigma is everywhere, right? And so one of the things we found in our first study was that a lot of young adults told us that they were reluctant to go to health clinics, brick and mortar in-person clinics, or to talk to healthcare workers because of their concern that they would be judged as so-called immoral young people. And this was especially true in countries where there are much more conservative norms about sexuality and sexual behavior. But in general, that many told us that they felt more comfortable going online because they felt they could be more anonymous and that they could find spaces where they would not be judged. And so that was really important to have that online access. However, what we're also finding with this new study, which is the findings and the observations Huang was discussing just now, is that when you go online as well, the fear of being judged can create also a self-censorship and a reluctance to share anything that might out you as being queer, as being sexually active, as living with HIV. And so that then inhibits you from sharing information that you might need to get advice online. So I don't know if we can really compare stigma in one place or the other. I would just say that it's everywhere and that it's a barrier to health service access everywhere. I don't know if you want to add anything to that, Huang, based on your work.
Yes, thank you, Meg. I just want to add from our experience when doing the PAR in Vietnam that stigmatization is also a problem when you want to gather the information from the study participant. So when we do the FGD as well as the KII, the stigmatization is the most important barrier that prevent us to meet with the right participant. So with the help from our VCAT member, they mobilize the study participant. So the stigmatization, they still have the afraid of being stigmatized. But with the help from the VCAT member, we can create some wonderful group discussion as well as some personal interview. So I think that is one thing we need to pay attention when doing the PAR, maybe in other country. Yes, so this is some experience sharing from Vietnam. Thank you.
Okay. Thanks both. And I'm not going to let you go just yet because we are on time and have a few minutes and a few other questions. So let me just share a few of them and maybe you can respond on ones you'd like to take. So one is linked to the stigma question. Is it difficult to reach regions where issues like HIV are viewed as taboo and therefore have people who hide their status or are unwilling to come forward to participate or offer information. I believe that will be in the research, but please clarify that if that's not correct. Another question about the recent, high-level UN Global Digital Compact, which was adopted back in September this year, and that communities are very grey on the same. So how best can we localize the agenda, such as the Global Digital Compact, to actually have an impact in the community and this work? And finally, what would you say the level of human rights knowledge and awareness is among your participants? Would you give any advice to projects seeking to undertake similar participatory action research, and especially in contexts where human rights are severely restricted? So I appreciate it's a few questions, but give you each a minute or so to respond to the ones that you feel you'd like to respond to, and then we're going to the next presentation. Thanks.
Huang, you want to go for anything?
Yes, over to you. Yes.
All right. On the Global Digital Compact, actually, I'm going to pass that one to Tabby because I think that is much more of a stop-AIDS question. And I think you probably have great insights there. But also would love to hear what our colleague from the Kenya Community Advisory Team has to say about that, because we'd really look to them for guidance as well. I think in terms of the question about whether certain issues are more prevalent, we definitely see differences. So while stigma was a huge issue across all of the countries, and we'll talk more about that when we share the findings next year, we definitely see that there are certain issues, such as the cost of accessing smartphones and airtime, which was much more important in Kenya, and I suspect will be very important in Ghana once we finish processing the data from Ghana. Whereas in Colombia, the economic issues and the economic barriers are also quite significant, but also geographic barriers. So the fact that if you go into the countryside, you may have less mobile coverage, less reliable Wi-Fi, and that also creates a barrier to accessing health information and services. I think the level of human rights knowledge, what we found is a huge interest in learning more about human rights. The people that we found who knew the most tended to be people who had been part of HIV movements for a while. And I think we especially have seen this in some of the groups we spoke with in Kenya, where we have real young activists who have been through many trainings, who have worked with community paralegals, and who have a strong sense of empowerment and a strong sense of their rights. By contrast, in some other places where people were less exposed to talk about their rights, they seem to feel more that solving the issue of abuse is more their individual responsibility, and less of a sense that other people have a role to play as well. Huang, did you want to add anything to any of that? Or disagree?
Yes, I just a quick mention first. I totally agree with you, Meg, and I think the PAR is a good approach, especially for Vietnam context, because in Vietnam, stigmatization for the study participant in this project is a very important thing that we need to overcome. Yes, thank you.
Great. Thank you both. And I'll take the question that Meg volunteered me for on the Global Digital Compact. So, our response as a project to this was fairly positive. We were really pleased to see a high-level agreement on this issue that had strong language on issues like digital literacy, which is incredibly important for our communities, and on data privacy, and with human rights as a foregrounding principle. We do feel that just going to share something in the chat, which is our statement and response. We do feel that implementation is now important. It's all good and well to have these agreements on paper. How do we move to implementation? And here, this is where our community advisory teams and the broader public can really play a role in holding their governments to account on the language and the commitments that are in there. And we'll be particularly keen to see that the Global Digital Compact is considered in terms of health. For example, a Ministry of Health analysing where their role would be in the implementation. We were pleased to see the UN Digital Human Rights Advisory Service, and look forward to what comes through that, and also to ensure that there are calls for young people and the broader communities to be involved in the implementation of that Global Digital Compact as it translates to services and new policies and so on. So yeah, thank you for the question. So thank you again to Meg and to Huang. We're now going to move to the second part of this webinar, which is around the new report from Digital Health and Rights Project, Gender Equity and Rights in Digital Health Strategies. And so I'm very pleased to hand over to Franco Serra, who led on this report and will share some of the key findings. I've been lucky to see some of these findings before, and there were some real surprises in there, so I think you'll all find it very interesting. Franco, I'll hand over to you.
Yeah, hello. Hi, Tavi, and hello, everyone. Thank you for being here. My name is Franco Serra. I'm a former researcher in the DHRP at the University of Warwick, which was my home for almost a year and a half before moving to Forlax last October for my PhD. So I would like to present this report today that we entitled Towards People-Centered Digital Health Strategy, Gender, Equity, Rights and Inclusion. And echoing Meg's initial words, I will also say that to our best knowledge, this is one of the first studies analyzing digital health strategy from a gender and human rights perspective. And it's worth it to mention that it was initiated at the invitation of the WHO Department of Digital Health, and is the result of a collaborative research work with some of the DHRP colleagues and with incredible feedback from WHO colleagues, as well as the civil society organization and youth leader and from the DHRP. So let's start. Please, next slide. Okay, so basically, our aim was to review 20 national digital health strategy from around the world through this lens of gender equity and human rights. And in doing so, we aim to identify sort of good practices, as well as the gap and the opportunity for improvement that could perhaps inform future normative guidance. So to give a sort of background on why this report is important, we should consider that in 2021, WHO launched this global digital health strategy with many important strategic objectives, but two of them are especially important for us. One is the strategic objective number 2, and that encourage member states to develop their own national digital health plans, but also strategic objective 4 that highlight this, let's say, need to address gender equality and health equity, ensuring that this digital technology do not harm and that everyone could benefit from this digital transformation, I would say. So please, next slide. So this last objective, I think that refers somehow to a broad and important body of literature showing that the digital transformation of health happens in a world that, of course, is already shaped by global and local inequalities. The risk of this transformation, we'll say, are not evenly distributed, but are experienced disproportionately by certain population in very diverse content, very diverse countries and even regions. So there are substantial evidence about why a gender equity and rights matter for digital health, some of which has been already pointed out when mentioned earlier about the finding of the previous research of the DHRP. I don't want to extend on this, but we can think about the digital device and how this direct impact access to health services and information. We also think about gender inequalities and how this influence all aspects of inclusion. Let's think about linguistic barrier, or geographical barrier that limit the access to digital health information, even for minority population. We can also think about privacy harms or surveillance risks that are particularly concerning when health data is used to target political dissidents. We also think about misinformation and online harm and how cyberbullying and online hate speech contribute to mental health harm, especially in in young people population. But also we can think about this social, political, and commercial determinant of digital health. And this is a quite broad field, which is include technological infrastructure and how the global health data governance works. And these are shaped by actual global inequality that constrain this equitable digital health transformation. So please, next slide. So let's go directly straight to the point. To analyze these national strategies, we first developed an assessment tool to evaluate how gender, equity, and human rights were considered and addressed within these plans. We review and took inspiration from tools and documents from WHO, UNAIDS, UN Women, and UNDP, but also brief and technical documents from International Development Organization. And we also based, and this is important, on international human rights norms and standards, and of course the findings from the DHRP previous participatory action research. So the tool that we developed included 24 questions, guiding questions across 7 categories. You can go and find this in the document. And we then selected 20 countries from different WHO regions in consultation with the WHO Department of Digital Health and Innovation. So we based this selection guiding by a series of criteria, including, for instance, geographical representation, income classification, population size, degree maturity of digital healthcare, diverse levels of strategy development, and we also included the 4 DHRP focus country in this analysis. So please, next slide. So these are the countries in our sample, and we took I think it's important to say that we took this document from the online repository that WHO has, which is a good source of data. You can check it. And in the report, you can find the reason and the justification of why we included each of these countries. I think that in this point, it's important to highlight for us that this is a small preliminary study, and the sampling we know that is not representative of all national digital health strategy, but serves like a sort of initial exploration on this topic. Please, next slide. So now let me to tell about some of the findings that we got from our analysis. I think that we can separate in 2 categories. One is the good practices, and the other the gaps and opportunities to improve. Let's start with the good practices here. One of them is that privacy, data security, and confidentiality are extensively recognized in most of the strategy. Just to give a flavor of this, 11 of the 20 strategy review explicitly reference privacy or data protection in the core principle or objective of the plans, and the remaining 9 indirectly reference terms such as data security, data governance, and so on and so forth. So this aspect is pretty covered, I would say, for most of the document. However, I think that it's important to highlight that we did not review the implementation of measure to protect privacy in practice. This is important. It's a kind of different discussion about this, but this is out of the scope of our analysis, but it's also important to consider. Another good practice that we found is that the majority of the strategy address current laws and policies that impact or could have an impact on digital health governance. Let's think about ICT infrastructure regulation, national health and care policy, and so on. One last good practice to mention is that 80% of the strategy under analysis include a specific section detailing, for instance, the implementation plan, showing clear accountability and transparency measure, indicator, timelines, and in some cases, monitoring and evaluation framework. This is quite important, and we see very extensively in our analysis. So please, next slide. And despite these strengths that I mentioned, we also found important gaps, but also opportunities and also broader challenges in our analysis. Let's start with the maybe bad news, I would say. In reviewing all these 20 strategies, we found that none of them addresses or gender equity question, which is quite concerned. And this means that all of them were essentially gender blind. We can stand on this later. We also found that the vision, the principles and objectives often lack reference to gender and equity. Overall, most of the strategies do not use a right-based language or refer to existing human right commitment in their plan. We also found that only 2 out of 20 strategies identify diverse population with specific need. This was the case that they do in the case of China. In the case of Laos, they propose concrete action for connect, reach, and remote population, or to attend specific consideration of the need of people with disabilities and so on. But in general, these were the exception to a more generalized approach that lacked specific plan or commitment to this population. Most of the strategy review reflect collaboration among health and communication ministry, which is quite important, but the support and coordination with many other partners may be needed, specifically when we are talking about provincial local health council in the implementation of the strategy. This is a lack of this is pending in the strategies. And also we saw a lack of reference to other ministry, particularly those that are maybe relevant to these kind of things, like National Human Rights Institution, the Ministry of Women, the Ministry of Diversity, of Youth, that could, we know, support the implementation of this policy. We also think that most of the strategy lack a meaningful participation mechanism for civil society, youth, and marginalized group in their development process. But we also find this kind of broader challenges, like those, for instance, that this strategy tend to focus on current technology and platform that falls within the remit of health ministry, but tend not to consider the challenge for health raised by, I would say, emerging trends. Let's think about AI, let's think about neurotechnology. So we saw little attention also to the widespread domestic use of health app, right, which is mostly developed by private actors, or the governance of sensible data in their possession. Also, the consideration of the impact of social media, which is why it's like an everyday thing, or a web platform for self-diagnosis. This is mostly not considered within our analysis. So the last point here is that while more, this is last point in this slide. While more of the half of the strategy evaluate and commit the development of training program, we found like significantly less consideration for digital health literacy in the general public. So when they appear, this digital literacy training is focused on healthcare professional and frontline staff, and is more really on a general public. And this training particularly is focused on broader digital skills and competencies rather than considering ethics, gender, or even human rights aspect. Please, next slide. So this is a quite overview of our report. You can check it, but before wrapping up, I would like to share a set of recommendations which derive from our findings. These recommendations, which are very general, aim to guide WHO, but also UN partner, member state, and other stakeholders in creating a more inclusive, human right-based digital health strategy, and so on. I will just mention briefly a few of them here. One is that we think that WHO experts, specifically those working on digital health and gender and human rights, should work together to integrate this lens in existing digital health strategy guidance and material that are using for internally, but also by member state. We also think that is needed to develop a specific assessment tool to evaluate this policy and integrate gender and human rights analysis on them. We also think that WHO, or we recommend that WHO and other UN agencies and member states should partner with each other and with the academia and civil society to work toward a digital health ecosystem, I would say, with this gender and human rights lens as well. In the other case, we recommend that UN agencies, the academia, and well, civil society organizations should gather evidence and example on how robust health data looks like and how this protection and privacy legislation looks like as a good examples. This exemplary exercise could be very beneficial. We also recommend that the funding agencies, the members and civil society should massively scale up investment in this digital health literacy that I mentioned, the training and programs, and develop digital right literacy program with a specific focus on human rights and gender as well. And two last, I would say that first, that the partner should facilitate these institutional spaces where young people, well, civil society, and where communities can actively and meaningful participate at national, subnational, I would say, regional and global digital health governance. And last but not least, we recommend, based on an analysis, that WHO and UN partners should invest in more capacity building for their staff and also for policymakers, lawmakers in member states on the impact of new and emerging digital health technology in a broad sense. We think about, as I say, neurotechnology, AI, and so on and so forth. Last slide, please. And that's all. Thank you. I look forward to continuing this conversation to you all. Back to you, Gabi.
Thank you so much, Franco, for that deep analysis. I remember getting this report, and I'm very lucky. I actually have a hard copy, which is like unheard of these days in the digital world. But I've underlined some of these stats because they just really stand out to me. So, yeah, you know, all of the strategies being considered here, gender blind, only a quarter of the strategies looked at had kind of reference to the inclusion of civil society and communities in the consultation of strategies. So really strong. So well done on all your work. And yeah, so now we're going to hear from two of our panelists. First, we're going to hear from James Kalu from the Kenya Community Advisory Team, also known as the KCAT. So I'll hand over to James to introduce yourself and how you found this report reflected with your experience and any recommendations that you have. Over to you, James.
All right. Thank you very much, Tabby. James Kilu. I'm part of the Kenya Community Advisory Team, and also I'm a finalist medical student in the University of Nairobi in Kenya. So I'll share my views on how this report aligns with what we see in the ground in Kenya, and also experience from other CAT members whom we are privileged to be with in Geneva in September, sharing about the same report. And also from the onset, it's I'll say that the report actually correctly captures and reflects the current situation in Kenya, and which serves as a representation of the broader global landscape, which right now is characterized by exclusion of certain groups in the digital health practice and global health practice. And the report highlights some inequities that not only manifest in Kenya, but also from the discussion that we had earlier, is the same issues which are being reported in Colombia, in Ghana, and in Vietnam. And as the digital health continues to expand, these inequities, which most of them are rooted in historical and social and cultural factors, are amplified in the digital space. And it becomes very crucial for us to aim to truly address them so that we can have a more inclusive healthcare system. So I'll just capture some of these inequities that I think they are very, very clear and very prominent in my country and also in the community which I work with and which I'm part of. So, for example, when you come to Kenya, the key populations, the LGBTQ individuals, the people living with HIV, the men who have sex with men, also and women also, they face significant systemic barriers to access health services, and it is more pronounced when we even come to digital health tools. And these groups often experience exclusion from healthcare and digital platforms. And this is driven by stigma, by discrimination, and also sociocultural factors. And sometimes they find refuge in getting these services from online spaces, and which sometimes are not very secure for them. So you find, as Meg said, you find there's some form of self-censorship to these key populations when it comes to accessing services online. And these inequities are driven by laws, by social stigmas and gender inequalities, as well as digital illiteracy. So it becomes important for us to recognize that if we fail to address these inequities, we are perpetuating a system that excludes rather than empowers these groups, already deepening already existing health disparities. And we can only address this by recognizing that marginalized populations are the only experts in their own experiences. And it is only by involving them in the design and implementation of digital health strategies that capture their lived experiences, that capture their situation, that we're doing justice to their realities. And also, these inequities are also driven by the failure of inclusion of this key population in decision-making processes for digital health policies and governance. So the strategies that are being developed by different countries, they don't capture the experiences of these people. And it can only be concluded that it is due to the failure to consult them in the process of developing these strategies. And this under representation of these marginalized groups in governance structures as to create policies at the end exclude or harm them. So that governance frameworks that do not intentionally integrate diverse voices fail to capture the full scope of the needs that these populations face, including things of accessibility, privacy, and also cultural relevance. So we must be very intentional in ensuring that the minority groups, every person is included in the digital health discussions, that we don't have just strategies that work for most of the people, but we also need to be very specific and very intentional to ensure that the very people who are usually forgotten, they are included. We have strategies that work for all people, not just for the majority. So we cannot have a system that are equitable without hearing from those who are most affected. The other thing is that when you come to Kenya, so we have things of digital divide. In that some populations, they lack the infrastructure, especially things to do with reliable internet access in the rural areas, issues to do with digital literacy, and even the high cost of mobile devices and even data, which create significant barriers to participate in the digital spaces. And it's important to realize that when we come to closing the digital divide, it's not just about providing access to these people. It's not just about providing internet. It's not about ensuring that they are smartphones. But it's more about ensuring equity in the health outcomes. So my colleague from Vietnam said that digital literacy goes beyond access. It goes beyond knowing how to use the devices. It is about the competence and also the confidence in using these platforms, being sure and being confident that you get the information that you want to get and is information that is reliable. And that is one factor that we need to consider, especially for key populations. to empower individuals in all areas, rural and marginalized, to access the same health information and services available to other people, even in developed nations. And also we need to create a future where digital health depends on democratizing the access to these technologies and skills, so that we need to broaden the scope and our understanding of what digital literacy means to different people and in different situations, to ensure that people have this competence and confidence in using these platforms to improve their own health. Also, marginalized populations also need to have a voice in the design of the digital health tools that directly affect their lives, and also to have the solution that meet their specific needs. And that means that we need to have more participatory governance structures, and to ensure that we don't have and ensure that there is inclusion for them in decision-making processes, to create solutions that are top-down or bottom-up, and they're not disconnected from the lived experiences of the marginalized populations. And also, lastly, then comes the question of data, because we all agree that data is what drives decisions. And without accurate data on key populations, on marginalized populations, we cannot address their specific health needs or design effective policies. And so we need to ensure equitable data collections that reflects the realities of marginalized groups to close the health equity gap. And also, we need to stop ignoring these populations in data if we truly want to create a healthcare system that is inclusive and equitable. And so it is the responsibility of all of us, the civil society, academia, and also WHO, to ensure that these key populations are protected and they are included in the global discussions and global practice in health. So we think that WHO could lead these discussions, for example, by developing normative guidance and indicators on what is meaningful participations for key populations. Because participation, our colleague from Ghana said that participation is not a one-day event. You just don't call people to a meeting one day, then get their views and assume that you understand fully their issues, their needs, and how to go about solving the problems that they face. And we know youth are experts in their own health needs. And without their input, we risk creating irrelevant strategies, irrelevant systems. So there's need to develop normative guidance of what really meaningful participation by young people, meaningful participation of key population means. And also we need to prioritize inclusivity in the development of global health strategies. And WHO has done a good work, and also we recommend them to continue doing the excellent work in advising countries and states on how to ensure the issues of gender equity and representation, inclusion of key populations is taken care in the policies that are developed by different countries. Lastly, we need to address the social determinants of health, including education, economic opportunities, and language inequalities. All those issues that compromise social participation, because these factors are the ones which also contribute to the digital divide, making it difficult for people to access healthcare and digital health tools. So that we don't just focus on digital health, because addressing health inequities means tackling the root causes, not just the symptoms, which we see as the case in digital health. So thank you very much. Those were my brief remarks.
Great, thank you, James. Lots of food for thought there on how to do meaningful participation and what that truly means for such diverse communities. So next I'm going to hand over to the WHO, to Tahani Alabda from the Digital Health and Innovation Department, to hear the WHO's response to some of these and some of their commitments that they have on gender equity and inclusion, and how they will act on these findings as well. So, Tahani.
Yeah, hello. If you can hear me?
Yes, we can
Yeah.
hear you.
Hello everyone. Just I will share my screen. I am Tahani, working as technical officer in the digital health, in the digital innovation department in WHO, and I'm really pleasure and happy to participate today for the Two World People Center Digital Health Strategy, Gender Equity and Inclusion today. Just 1 minute to share my screen. Can you see my screen?
Yes, we can see the screen. It's not on the slideshow presentation, but we can see it.
Yeah.
There we go. Perfect.
Just one.
No worries. While we wait, I'll just take this moment to remind everyone that we'll do a Q&A after we hear from Tahani. So do get your questions ready.
So now you can see my screen.
Yes, we can see your screen.
Yeah, okay. So thank you very much, everyone, for participation today and for the really interesting topic. Actually, I'd like first to have a little bit to go back to our workshop, which held in September 26 and 27, that organized in collaboration with University of Warwick and WHO, with partners who participate at that time from UN agency, GER, Gender Equity and Right, from WHO also department, the youth champion, civil society, and it was many stakeholders at that time. And that workshop was focused on integrating gender equity, rights, and inclusion into digital health strategy. I share with you some picture from that workshop. It was 2 days workshop to review and discuss the preliminary report findings. That shared today briefest in the presentation, gather insight from participants based on their experience and the recommendation at that time, and address the gap in current framework and to ensure truly people-centered approach to digital health transformation. Some of the picture that time with the Warwick University and from WHO team. And really, it was during that workshop, it was numerous of discussion to took place, leading to several actually key findings at that time. This is one of Vida and the team at that time sharing. Let's go a little bit about the global digital health strategy. And as we know, we have four objectives in regard to the digital health strategy. And this global digital strategy approved by all member states and through the WHO 73 in November 2020 endorsed the four objectives for comprehensive digital health enabling environment. The strategy call upon member states to develop national digital health strategy, and as our topics objective 2, which addressing gender equality and health equity to ensure that digital technology do no harm and all
Sorry,
are able to.
Tahani, the slides are not advancing. I don't know if you're clicking through, but we're just seeing the cover slide, not the other pictures. Sorry to interrupt.
Oh, sorry. I thought it's coming because I will stop sharing.
Yeah, it might be in a different window. Yeah.
I'll stop sharing maybe.
Yeah, maybe if you reshare, maybe we'll be able to see.
Because it's with me, it's moving. So maybe Franco
Microsoft
can,
Teams.
yeah.
Teams
Maybe
can be weird.
can, yeah. Franco, could you, or Tabitha, could you please share it with me, please?
I don't know if the HRP team has the slides.
I share with
I don't
Tabitha.
know.
We
Tabitha, if you
we
could-
don't have the slides, unfortunately.
Yeah, I sent it to Tabitha. If you could you please share it? Because when I just click on that, it's with me, it's moving. So
Okay, if you can share them with our team, then yeah, we'll make sure they get to the right person.
okay,
Try and
sure.
support. Yeah.
Maybe if you just want to talk through your talking points, and then we'll see if you email the slides to us, we can try and share them. But I would say just go ahead and speak just because of the time. Thanks.
Yeah, sure. Yeah, I just share it with the teams. So I will go through if anyone can just share it, or I will go through the explanation.
Okay, thank you, Sadi. I have them. We'll try and sort this
Yeah,
out in the
sure.
back end. Feel free to keep going through it.
Yeah. So as we said, in these 2 days of the workshop, actually, we have reviewed and discussed the report findings, gather insight from the participants, addressing the gap in current framework, and to ensure a truly people-centered approach to digital health transformation. As if it could what's with from the picture, we saw the team of the work and WHO, and actually at that time during the workshop, numerous of discussion took place, leading to several key findings at that time. Several key findings they discussed at that time: the gap in gender and equality integration, most national strategy, lacks of focus on gender inequality, human rights consideration, also marginalized group and persons with disabilities are underrepresented in strategy development and access. Digital literacy a challenge, human rights concern. I wish that if it could be at least we present the objectives for the digital health strategy, which is covering the 4 strategy objectives. The global strategy approved by all member states during the WHO Health Assembly 73 in November 2020, endorsed the 4th strategy objectives: comprehensive digital health enabling environment. The strategy call upon member states develop the national digital health strategy, which is listed under the objective number 2, to addressing gender equality and health equity, to ensure that digital technology do no harm and are all able to enjoy the benefit. And the objective number 4, bring together action toward collaboration and knowledge transfer, advancing implementation, strengthening governance for digital health, and advocating digital health enabled people centered health system. Okay, that's good. Can share the screen. So please, if it's number 7, please, slide number 7. If we can go just the picture for the just for the audience to see.
Yeah.
Yeah.
Okay, there you go.
Yeah. So when we mentioned that global strategy in digital health, as we said, this is for objectives of the digital health strategy, and it's signed to number 2 and 4 is aligned under it, the do no harm and able to enjoy all the benefits. Also bring together action toward collaboration and knowledge transfer, advancing implementation, strengthening governance for digital health, and advocate digital health enable people-centered health system. Next slide, please. For the World Health Organization, play a crucial role in G20. So in G20, providing technical expertise and guidance in global health priority, including different topics, pandemic preparedness, health system strengthening, universal health coverage, promoting gender equity in health. WHO collaborates with G20 nations to address pressing health challenge and advance equitable, inclusive healthcare solution worldwide. Maybe if you just press enable editing, so we can just go move. So slide number 8, please. So as we mentioned that different topics is like in G20 Saudi Arabia declaration, it was covering digital health task force during COVID-19, G20 Indonesia, global interoperability, health certificate, India and Brazil. And all through this G20s, World Health play a role in, as we said, providing technical expertise and guidance on the global health priority. Next, please. Also, we can also guide through global initiative in digital health, what I will talk a little about it, and I will share the website. The 4 pillars from GUIDA aims to strengthen alignment and knowledge exchange for country-led national digital health transformation. These 4 pillars, as you see, the global initiative in health is supported by 4 elements. Country need tracker, help nation assess the digital health gaps and priority. The country resource portal provide centralized hub for sharing valuable and digital health resource. The transformation toolbox offer practical tools and framework to support country in implementation and scaling digital health solution. Finally, convening and knowledge exchange, foster collaboration and learning among global stakeholders to drive innovative and progress digital health. In GUIDA, next please. A lot of effort also before the recommendation, a lot of effort has gone into engaging with stakeholders across the global digital health in this space, listening to member states and creating with India G20 residency and structure. As we said, GUIDA. The platform of GUIDA, as what is a back of me, through the initiative of GUIDA, provide a platform member state to share practice from one another, and they developed and refined their national strategy. For this platform, it's really a framework for guidance. The initiative provide technical standard, best practice and policy guidance to assist country in developing, implementing and scaling digital health strategy, a driver for equity and inclusion, also emphasize the integration of gender equity and human rights. From that workshop, to ensure the digital transformation of health system, can go to the next slide. Ensure the digital transformation of health system is truly inclusive and equitable. The following recommendations were developed for this initiative. I think I will try to share from my side because this is not the we did adding that, so I will share from my side.
Okay, you can let us know which slide if that helps, but just to say we do want to save some time for Q&A, so if you could finish up in a minute or so, please. Thank you.
Sure. I think it's you see my screen?
We can see the cover slide.
Yeah, but we will try to. We tried before it's the same.
I'm afraid it doesn't change. I would suggest, just because of time, is it possible to talk?
Yeah, sure.
Points instead. We can always share key information after the.
Now, is it changed or not yet?
Yeah, that's changed now. Yes. Yeah, we've got there.
Okay, so
So just final minute, please.
Yeah, okay, sure. So it's also we go including the recommendation at that time after the workshop. So integrate gender equity and right into digital health guidance, which to ensure the digital health solution and inclusive, equitable, and right-based, emphasize that digital health system should be designed to meet the need of the all population. Enhance collaboration across sectors, foster partnership between health ministry, ICT department, civil society, to the private sector to develop inclusive and equitable digital health strategy. Strengthen interagency coordination within the own system to address gender and equality challenge. Improve inclusivity in strategy development to engage marginalized groups, civil society, and youth leaders to ensure their needs and perspective are reflected in digital health strategy. Expand research and evidence collection. As we know, it's very important to conduct further research on the impact of digital health solution on gender equity and marginalized population. Comply and disseminate best practice and lesson learned globally. Leverage technology responsibility, develop the AI tools that are from based culturally appropriate, create regularly framework to govern ethical AI using health while addressing assure privacy and security. Supporting national capacity building, which is really emphasized in this point. To include helping government and health system to develop digital tools are responsive to the right need of marginalized population. Launch advocacy and outreach efforts. Sure, it's important to engage donor to mobilize resources for inclusive digital health initiative. Sure, and strengthen privacy and data security. Strengthen this aspect will enhance trust and ensure the protection of health data and privacy legislation. Integrate right-based approach, ensuring digital health initiative respect and protect privacy and data security. Here, an example I added as WISES, as the United Nations agency, the World Health Organization has a broad mandate to contribute to the outcome of the World Summit in the Information Society and ensure prioritize of adequate resource in this context. In particular, WHO serves as the lead facilitator for WISES action line C7. This role underscores WHO commitment to advance the use of information and communication technology for health, commonly referred to as e-health or digital health. As part of this effort, WHO has included a focus on gender in WISES Plus 20 report, as you see in the left of the big slide, highlighting the importance of gender equity in digital health initiative.
Thank you, Tahani. I'm so sorry to interrupt, but we
no, it's
luckily
fine.
it's the end anyway.
But yeah, for the slide, I tried to cover that quickly, and sorry for the slide. Yeah, show at the end WHO. I will share the guide. It's really useful link for the website, and sure, WHO with the collaboration with everyone, we are happy to help create digital health system that leave no one behind. Thank you all.
Thank you, and sorry to cut you short because it's always great to see the kind of next steps and how it's going into being taken into practice as well. So we just have just under 5 minutes for the Q&A. So really welcome your questions in the Q&A function, which you can click at the top of your screen. So yeah, as a reminder, we heard from Franco on the report of the initial analysis of the 20 national digital health strategies, and then from James and his experience as a Kenya Community Advisory Team member, and then from Tahani now from WHO. So any questions? And if not, then I have some, so I'm happy to go ahead. Okay, I'll kick off with one or two, and then we can see if there's any questions remaining for our last 5 minutes. So really, Franco, question on your analysis, and yeah, what were the main challenges you faced in conducting this kind of cross-country analysis of such diverse policy approaches. And to James, a question really, like, how will your team, the KCAT, include the insights from your research, that the research that found this and this report into your advocacy as you move into that stage of your work? So start with Franco and then James.
I can start. Yeah. I have two reactions to that question. I already mentioned that we did not review the stringency and implementation of this national plan, and this has like a good and bad caveat. Some strategy can complain in the paper that are positive for a question, but there is a gap in practice, and the other way around. And the other point is that I think that we encounter like some difficulties in navigating this policy diversity, right? There are countries with vary significantly in the development of implementation of the national digital health strategy, from highly like mature system in Estonia and to countries that just beginning to establish in the framework in for instance Sierra Leone. So this complicates the sort of cross-country analysis in a way that require tailoring somehow the evaluation criteria to this kind of differences there. On the other hand, that can be simple silly, but I would say that this diverse definition of the terms like right, gender, equity across policy documents may have some complicated consistent evaluation. Right, this term often interpret differently depending on the socio-political and cultural context, and these make some difficulties to standardize and analyze this direct question that we have in the comparison of this question. Last point here is that we have some sort of language barrier. We only analyze digital health strategy in English, Spanish, French, and Chinese, which is a lot for or highly competitive but short team. So the limitation here is due to our language constraint. But this is like, well, we don't have like a less comprehensive representation of national digital health strategy. So I think that further research on this line will be quite beneficial to this. Thank you.
Great. Thank you, Franco. And yeah, James, the question I asked around how will your team kind of take these insights forward? And then we'll come to a final question for Tahani.
Okay, thank you. Just first to say that the CAT that we have, the community advisory team, usually is as members who represent the diverse populations, was critical stake in healthcare and in digital health. We have key populations, we have human rights activists and lawyers there. So the representation through the CAT placed them at the forefront of their own health management, because the CAT actually represent the community. And this ensures that we bring these issues which the community faces to global spaces. And we plan to leverage on participatory and community-focused approaches to advocate for inclusive digital health strategies by directly involving marginalized populations in these conversations. We use insights that we get from the research that is being conducted, insights from spaces such as this, to highlight the lived experiences and unique challenges of groups like LGBTQ, people living with HIV, and women in accessing digital health tools. And we hope that this evidence will go a long way in informing policies. And we also use public campaigns and engage different stakeholders to push for equitable access and also things about data protection. Now, specifically for this, the findings are very critical, and we are going to use the recommendation from the report to strengthen the advocacy by addressing key inequities and integrating evidence-based solutions into policy discussions. And this has already begun 2 weeks ago. So in Kenya, we are developing the digital health strategy, a new one, spanning 2025 to 2031 to replace the old strategy, which was analyzed in this research. And we had members of the CAT who went for a public participation about the same, and who were very, very keen and raised the issues about gender equality, raised the issues about accountability measures and inclusion of different populations. So we are working hard to ensure that all individuals are included into these policy discussions.
Mhm. That's great.
And also, lastly,
yes.
we also been talking about ensuring that we have right-based language in digital strategies. The language that is being used in these strategies was also another thing which was raised in that meeting, which happened the last 2 weeks. So to say that we have already started acting on the recommendation of this report to ensure that the issues of gender equity inclusions are taken care of and given the way that they deserve.
Great, it's great to hear it's moving forward already. Thank you, James. Just lastly, and then we'll wrap up, just want to give space for this question for Tahani around the Global Digital Health Strategy has these commitments to ensuring human rights and gender equality are addressed. Sorry, that's not the right question. It's please provide more clarity on the steps the WHO is taking to integrate gender and human rights considerations into the guide's implementation. So I'll hand over to you and then we will close up after that. Thank you.
Yeah, sure. Thank you for the interesting question. And really, actually WHO working with the member states. We just released in October the first draft of the report of Global Digital Health Strategy. Maybe we contact with Meg that at that time we have like limit of numbers 2,200 word to submit the, but sure, WHO work closely to inshallah to include this in the, because the digital health strategy 2020 to 2025, and WHO now working to upgrade, to extend 2 years, then to 5 years. So we submit this in October, and will be another submission for the report also in February. So with the regional office, they have a lot of work in regard, but as we said, we not mentioned that in the report, the first draft, but we mentioned it in the WISES. I'm sure moving forward as such important topics and webinar and this effort, sure will be, in future we will see this topic in digital strategy. Thank you. This is what in my level, I'm sure about it, and we will submit it in October. Thank you very much, all.
Thank you so much. Apologies for overrunning, but thank you. Huge thank you to all of our speakers for sharing all the progress made, the reports, the action taken so far. It's really exciting. I think there was going to be a link shared to get people to sign up to the mailing list for Digital Health and Rights Project if you haven't already. And otherwise, yeah, thank you again for joining. We'll look to see if there's any unanswered questions that we need to answer on LinkedIn or on X. Do follow us, and yeah, thank you again. Enjoy your day.
Thank you.
Take care.
Thank you. Bye-bye.
Thank you.